Today we'll be dealing with the venous drainage of the thoracic wall. More specifically, we'll be dealing with the Azygos system of veins in detail. First of all, I'm going to ask you, what is the meaning of the word azygos? In this diagram, we can see the azygos vein. It's on the right side of the vertebral column in the posterior mediastinum. So can anyone tell me the meaning of the word azygos? Yes.
Single.
Yes. Azygos means single or unpaired. As we were learning the anatomy of the limbs, you would have encountered many structures which come in pairs, that is for the right and left sides of the body. But the azygos system of veins consists of certain veins which do not have a corresponding pair. They are present as a single structure. So today we're going to learn about 3 of those major veins that are present in the azygos system. First, we're going to learn about the azygos vein. As with any blood vessel, you need to know the origin, course, termination. And since this is the venous system, you're also going to learn about the tributaries and the areas of drainage. This is a frequently asked short note for you and also for your dissection discussion for Viva. If you have a specimen of the mediastinum, usually you can expect these questions. Let's look at the site of the azygos vein. In this diagram, we can see the thoracic cavity. If you can identify the ribs and the vertebrae, you're looking at the posterior aspect of the thoracic cavity. This region is a thoracic cavity and lower down the abdominal cavity. You know that the thoracic and the abdominal cavities are separated by the thoracic diaphragm. The azygos vein, it starts in the abdominal cavity, in the posterior abdominal wall. At its origin, this is the azygos vein. Then it enters into the posterior mediastinum. So though azygos vein is draining the posterior thoracic wall, its origin is in the posterior abdominal wall. Let's study the formation of the azygos vein. When you look at this diagram, this lower down is where the azygos vein is formed. So you can see in the diagram, azygos vein is formed by union of the right subcostal vein and right ascending lumbar vein. Now, since this is a vein, there are certain variations in its formation. So the most common way in which the azygos vein is formed is by the right subcostal vein joining with right ascending lumbar vein. Whereas in some individuals, azygos vein can also arise from the lumbar azygos vein. Okay, so this is represented in dotted lines in the diagram. Lumbar azygos vein is a vein which arises from the posterior aspect of the inferior vena cava. So that is represented in dotted lines. So in some individuals, azygos vein arises from the lumbar azygos vein, whereas in most individuals, it is formed by the union of right subcostal vein and right ascending lumbar vein. Okay, so all of you need to know the first point, especially about formation of the azygos vein. So this is to show you the thoracic diaphragm. Okay, the diaphragm has two domes. It is a musculo-aponeurotic structure. This is the inferior surface of diaphragm. If you look closely, there are two extensions of the diaphragm. Okay, this is the attachment of the diaphragm on the vertebral bodies. Okay, posteriorly, the attachment of the diaphragm onto the vertebral bodies is named as the right crus of diaphragm and the left crus of diaphragm. In between the right and left crus, you can see an opening called the aortic opening. This is how the descending thoracic aorta enters into the abdominal cavity. I am just giving you an overview of the diaphragm so that you can understand how does the azygos vein enter the thoracic cavity from the abdominal cavity. So the azygos vein passes through the aortic opening of diaphragm and then enters into the thoracic cavity. So it was formed in the posterior abdominal wall. Next, it passes through the aortic opening of diaphragm and then enters into the posterior mediastinum. So what about the course of the azygos vein? Okay, so in this diagram, this is the azygos vein. So can you tell me, is azygos vein on the right side or the left side of the vertebral column or in the posterior mediastinum? Is it in the midline, right side or left side? Yes, it's on the right side of the vertebral column. Good. So please keep this in mind, all of you, even when you're looking at the dissection specimens. Okay, the azygos vein is towards the right side of the vertebral column. Good. So the course of azygos vein is that it will travel vertically upward in front of the bodies of the vertebrae up to the level of T4. So what is the bony landmark of the thoracic wall at the level of T4? Any bony landmark on the anterior thoracic wall at the level of T4? Yes, very good. T4 is the level of the sternal angle or the angle of Louis. So please remember, the azygos vein travels up to the level of T4 vertically. Then what happens is the azygos vein forms an arch. The arch of azygos vein, the arch will be superior to the hilum of the right lung. Okay, so now I just want you to have a small flashback of the medial surface of the right lung. Okay, structures related to the medial surface of the right lung. If you remember, we had learned that right lung is related to veins mostly, and superior to the hilum of right lung, there is the arch of azygos vein, the impression for arch of azygos vein. And finally, the azygos vein will drain into superior vena cava. Superior vena cava will further pierce the fibrous pericardium of the heart. So azygos vein drains into superior vena cava before the superior vena cava pierces the fibrous pericardium. This is the origin, course, and termination of the azygos vein. Now we have to learn about the tributaries. So this beautiful diagram is what we are going to learn in today's lecture class. Okay, it looks a bit confusing with a lot of names and a lot of markings, but let's try to learn this diagram together. We are going to split this diagram into the right and left sides, and then we will deal with it. So if you have your color pencils and your notebooks with you, please draw it along with the class as I explain. Okay, so we are learning about the azygos vein, which is on the right side of the vertebral column. But you also need to know about the tributaries of the superior vena cava. The azygos vein finally drains into superior vena cava. Okay. When you're drawing the diagram, first of all, you need the heading, which is the veins of the thoracic wall or veins of the posterior mediastinum. And for your easy learning, you can divide the diagram into right and left sides. The first vein that you're going to draw, okay, two vertical veins, which is actually emerging from the neck. That is the internal jugular vein. Next, joining with the internal jugular vein is the subclavian vein. Continuation of axillary vein at the root of the neck is the subclavian vein. So the internal jugular vein and subclavian vein will join together to form brachiocephalic vein. Okay, so the right brachiocephalic vein is vertically oriented, whereas the left brachiocephalic vein is having a longer course. Okay, so the left brachiocephalic vein, it is formed on the left side, but it crosses the midline and will join with the right brachiocephalic vein. Together, they drain into the superior vena cava. Okay, so now we're going to learn about the azygos vein. That is in relation to the inferior vena cava. So this is lower down in the posterior abdominal wall. Yes, so does anyone remember how is azygos vein formed, or what is the most common mode of formation of azygos vein? Union of which two veins forms the azygos vein?
Right
Right
subcostal and
right
right lumbar.
ascending lumbar vein.
Yes, very good. Yes, an eager class. Happy to hear you know the answer. Okay, so we're going to draw the right subcostal vein. Now the name itself, subcostal, actually means it is the 12th posterior intercostal vein. Okay, it is below the 12th rib, but the actual correct terminology for it is subcostal vein. So it is the right subcostal vein, which will join with right ascending lumbar vein, and it forms the azygos vein. Now you should all remember at the level of T4, azygos vein forms the arch of azygos vein, which will finally drain into superior vena cava. So please remember this level where the arch is formed is at the level of T4. Okay, so far you got the basic skeleton of the diagram on the right side. Now we're going to learn about tributaries of the azygos vein, that is the posterior intercostal veins. So if you remember the class on intercostal spaces, you would remember that in the upper 9 spaces, there are 2 anterior intercostal arteries and 1 posterior intercostal artery. Okay, so corresponding with the posterior intercostal artery, there is also the posterior intercostal vein. Okay, if you remember the intercostal space class. Okay, so let me just ask you as a revision, what are the structures present within the costal groove of the rib? There is a neurovascular bundle. So what are the structures present in the costal groove in order? Do you remember from superior to inferior? Yes, all of you remember, it is the intercostal vein, artery, and nerve. Okay, so we are learning about the intercostal vein, and from the angle of rib posteriorly in the posterior mediastinum, it is the posterior intercostal vein that we are dealing with. Good. Okay, so how many intercostal spaces are present in total? There are 12 pairs of ribs. So how many intercostal spaces are present?
11.
Yes, there are 11 intercostal spaces. So in each of those spaces, there is the intercostal vein. So the intercostal veins are numbered according to the space in which they are present. So let's look at how they drain into this venous system. The first posterior intercostal vein is also known as the highest intercostal vein. This is the first posterior intercostal vein. It will drain into the right brachiocephalic vein. The first posterior intercostal vein drains into the right brachiocephalic vein. The second, third, and fourth posterior intercostal veins, okay, 2, 3, and 4, will join together to form superior intercostal vein. Superior intercostal vein on the right side will drain into arch of Azygos vein. Okay, so the first intercostal vein drains separately into right brachiocephalic vein. Posterior intercostal veins 2, 3, and 4 will join together to form superior intercostal vein, which drains into arch of Azygos vein. So based on this diagram, can you guess intercostal vein 5 to 11, where will it drain into? Okay, this remaining space. Yes, can you just take a guess? The remaining intercostal veins on the right side, where will it drain into? Anyone would like to take a guess? Yes, Azygos vein. Yes, that's easy enough. Okay, all the other posterior intercostal veins here, okay, from 5 to 11 will drain into the Azygos vein on the right side. Okay, so I hope you all have drawn this and you have an idea about the veins on the right side of the posterior mediastinum. Now, sometimes the groups that are powerful come in threes. So just like that, the Azygos vein has two other friends to help it drain the posterior mediastinum. That is the Azygos. Then the other two have similar names, which are the hemiazygos vein and accessory hemiazygos vein. Okay, so I want you to remember these three names. The Azygos vein is towards the right side of the posterior mediastinum, whereas hemiazygos and accessory hemiazygos is towards the left side. So when you're writing your short note, you can draw this diagram and you can mention the tributaries of the Azygos vein. So I taught you about the drainage of the posterior intercostal veins into the Azygos vein. When you're mentioning tributaries, you also have to say the formative tributaries. The formative tributaries are the right subcostal vein and right ascending lumbar vein. Then if you look at this diagram, you can also see this is hemiazygos vein on the left side. Okay, we'll be dealing dealing with hemiazygous vein in detail in a minute. Okay, this hemiazygous vein and accessory hemiazygous vein also drain into azygous vein. And these are other tributaries of azygous vein. If you are interested, you can learn just basically the structures in the mediastinum. Okay, there are veins from the pericardium, veins from the posterior mediastinum, veins from the esophagus, and the right bronchial veins. They all drain into the azygous vein, hemiazygous vein. Can you tell me the formation of hemiazygous vein? If you look at the diagram, it'll give you a clue. Formation of hemiazygous vein is somewhat similar to the azygous vein on the right side. Yes, so this is hemiazygous vein on the left side. So can you see the formation?
Left subcostal vein
Yes,
and left ascending lumbar vein.
yes, very good. The formation of hemiazygous vein is by left subcostal vein and left ascending lumbar vein. Good. And how does the hemiazygous vein enter into the posterior mediastinum? The hemiazygous vein will pierce the diaphragm. Specifically, it will pierce the part of diaphragm known as the left crus of the diaphragm and then enter into the posterior mediastinum. And if you look here, okay, this is the hemiazygous vein. It is on the left side of the vertebral column, but at the level of T8, it will cross to the opposite side and enter into the azygous vein. So if you remember, azygous vein forms an arch at the level of T4. So for hemiazygous vein, the vertebral level is double the azygous vein. Okay, azygous vein will form the arch of azygous at the level of T4, whereas the hemiazygous vein crosses the vertebral column, okay, crosses the midline at the level of T8. And finally, it enters into the azygous vein. The course of hemiazygous vein is slightly simple. Okay? Formed in the posterior abdominal wall, pierces the left crus of diaphragm, ascends vertically along the left side of the vertebral column. At level of T8, cross the midline, the left subcostal and left ascending lumbar veins together will form the hemiazygous vein. And hemiazygous vein at the level of T8 crosses the midline and drains into the azygous vein. So you can draw the hemiazygous vein vertically up to the level of T8, okay, corresponding to the 8th posterior intercostal vein, and then it drains into the azygous vein by crossing the midline. So since it's at the level of T8, okay, the posterior intercostal veins which drain into hemiazygous veins are the posterior intercostal vein numbered from 8 to 11 on the left side. Okay, so please remember these numbers. Posterior intercostal vein 8 to 11. That's about the hemiazygous vein. What about the accessory hemiazygous vein? So the posterior intercostal vein number 5. You have to remember the number 5 will continue as accessory hemiazygous vein. So the 5th posterior intercostal vein on the left side continues as accessory hemiazygous vein, which will cross the midline at level of T7 and enter into the azygous vein. So remember, accessory hemiazygous vein crosses the midline at the level of 7th thoracic vertebra. So, naturally the other tributaries will be the posterior intercostal vein 6 and 7. So for the right side, you have to remember posterior intercostal vein 5 to 11 all will drain into azygous vein. Whereas on the left side, posterior intercostal vein 8 to 11 drain into hemiazygous vein, whereas 5 to 7 drain into accessory hemiazygous vein. What about the intercostal vein 1 to 4 on the left side? The first posterior intercostal vein drains directly into the left brachiocephalic vein, whereas the posterior intercostal vein 2, 3, and 4 will form superior intercostal vein on left side, which also drains into the left brachiocephalic vein.